My name is Brendan Cox. I am a speaker for the Law Enforcement Action Partnership, and I am a retired police chief from the Albany, New York Police Department. I am here to support local, state, and federal legislative action to decriminalize the use of drugs. I believe strongly that that is needed across the board to recognize that that is ultimately a step in the end of the war on drugs, that is a step that actually increases public safety and increases the relationship, the positive relationship between our communities and our police departments. And that is a big step in ultimately helping the reform of the criminal legal system. Harm reduction is a public health approach to reducing the risk of a behavior. And it's recognizing that when we look at drug use, we can look at any risky behavior, but it's recognizing that we can reduce the risk of that behavior by implementing certain protections and we can implement certain pieces of work to reduce that risk and make that person's life better and improve the life, in fact, of the community and the public in a whole. And how we do that is we meet that person where they're at, both figuratively and literally. So if we want to use drug use as the example, if somebody's saying I'm still going to utilize drugs, we meet them there. We recognize that. But we don't leave them there. We find a means to start bringing them to a place where they're safer. We start recognizing that we can provide services to them to address other needs they might have. And we start making incremental changes because we recognize that in the stages of change, that it takes people a while to make change. Sometimes people are not ready at all to even face the issue that they need to change. Other times people know that there's an issue they have that they need to change, but that they're not ready to take a major shift in their life, a major change. So we help them make incremental changes and we ultimately make their life better. And many times there's multiple things happening in somebody's life that it's not necessarily the behavior itself that is ultimately what we need to address. There's an underlying issue. And if we continue to look at substance use, we know that right now we have a lot of issues around mental health. And when we concentrate too much, especially from a law enforcement perspective or a public safety perspective, if we concentrate too much on substance use, we may never get to the trauma or the mental health issue that's lying below that if all we do is worry about the substance use. And we see that over and over again, both locally here in New York and across the country, where if we reduce the risk of the substance use, if we keep somebody alive, many times we get to the underlying trauma through building that relationship with them and ultimately wind up solving the issues of what the root cause is through trauma, through mental health, by building a relationship and getting that long-term harm under control that way. So when it comes to psychedelics, I guess number one, first of all, we know through research that psychedelics can actually help people. They can help folks with PTSD. We know psychedelics can help folks with using substances like heroin, who have substance use disorders in that fashion. So we think about it, like when we talk about a harm reduction. If we know about somebody having a heroin addiction, and with especially today's world where it's impossible to get heroin. In fact, most people are only able to get fentanyl even if they don't want fentanyl. So if we know that psychedelics can actually help reduce the usage of heroin and people are really using fentanyl because they can't get heroin, you can actually reduce deaths. So psychedelics can help out folks with PTSD, can help out folks with opiates, all kinds of other issues. So we know that psychedelics have a benefit. We also know that psychedelics aren't causing some kind of rash number of public safety calls across the state, aren't causing some rash number of calls for service across the country. Places that have already decriminalized psychedelics, Denver, other places, there's not some big number of public safety issues going on. In my career, certainly there weren't a large number of calls for psychedelics or psychedelic arrests. Usually the only time we would see a large increase would be if there was a certain concert in town or if there was a certain festival. And even then, those were very concentrated and it was because of the large mass that was in town, not necessarily because of the drug itself. So we know that there's actually benefits and we know that there's not necessarily a large public safety issue. We also know that policy can help drive public safety, and policy can help drive where we are in today's world with reducing certain police contacts. So if we think about what could happen by having a legislative body have a policy in place for the municipality that ultimately decriminalizes a psychedelic, that ultimately makes psychedelic enforcement be the lowest rung on the ladder for the local police department, that says we're not going to actively enforce psychedelics because we recognize the benefits of psychedelics and because we recognize that this is not what we should be concentrating on. There's other serious issues. We actually can increase the transparency and the support of the community, the relationships happening with the police. We can ultimately recognize that we need to concentrate on higher things, and that legislative body helps drive policy that the public wants to see, helps drive policy of increasing positive interactions between the community and the police, of where we want to be, how we want to interact, what we want to interact on, and what we don't want to interact on, what we don't want to spend our time doing for no legitimate purpose, have no need to ultimately do. So policy driven by our local legislative body on these issues makes sense and ultimately can really help both the public and the police department out. And there's no, again, there's no big public scare over psychedelics. And at the end of the day, once again, we come down to a public health issue. So there's a lot that can be done around education when it comes to psychedelics as opposed to enforcement, which is another public health approach. It's another harm reduction approach. Educate folks about what's really there, what the effects really are, and then what community-based organizations can help out in any case that there is an issue, so folks know who to call. So the police, if they do get a call, they can refer this to the right system, to the right partner. And when it comes to psychedelics, the reason why we want that community partner, that we want somebody else to be able to reach out to, is because of a number of factors. So if somebody is ultimately having a bad trip, if somebody is having a bad reaction to the psychedelic, certainly it's much better if there is a community partner that has experience in handling these issues, who's not necessarily showing up in a uniform, is the person that's making that contact. Makes more sense. They're going to be able to de-escalate the situation. They're going to be able to know what the best steps is to take care of with that next person, and they're going to know whether or not they need to get that person to the hospital or they just need to sit with that person for a bit, how to take the next steps. We also know that police departments, we don't want to bring that person into custody. We don't want to bring that person into our central booking, into a jail. That doesn't make any sense. In fact, that just might make the situation worse. So either have that community partner that can do that outreach by themselves, or in partnership with the police. That might need to be the next, if that's the only solution to where you need both the police and the community partner, that also can work. But at the end of the day, that community partner that understands the response, that has more of an expertise, can be the person that can make that outreach either by themselves or in coordination with the police, and have a better idea of what to do, really help de-escalate the situation, and then can also do that follow-up later on to really talk to that individual to figure out, like, hey, this is what happened, what can we do in the future for you, either on any kind of follow-up if you were to do this again, or if you were to not do this again. Why local police and local legislative bodies should look at decriminalizing psychedelics and should look at passing legislative solutions to this is recognizing that psychedelics are there already. There is more psychedelic action coming, or more interactions with psychedelics coming as part of the medical world, as part of the religious world, as part of folks using as their own stabilization in life, and that neither police chiefs nor the legislative bodies are experts. I certainly am not going to claim that I'm an expert on that piece, and that by looking at this decriminalization process and talking to the experts, you'll actually have a better understanding of this and be prepared for it, and recognize that your municipality, your community will be better off served by having that in place, and your community can be better educated. So that way, as your community wants to know more, you'll be better prepared. So really get the experts in, get the experts to the table, talk to the experts, find out what is what. None of us know everything, none of us ever can. And at the end of the day, if we don't get the right people to the table, we're not going to know that. So we all tend to be scared off by illicit drugs based on our moral beliefs, based on what we've been told, much of which is false. And if we're going to end the war on drugs, and if we're actually going to have the right legislative pieces, if we're going to have the right policies moving forward, if we're going to do right by our communities and we're going to actually be just, then we should have the right partners at the table. We should ultimately make sure that we do our homework and that we put the correct legislative proposals forward. So when I talk about bringing in the experts, as police chiefs, as legislative bodies, we need to get the right people to the table. We need to be able to rely on experts because we can't possibly know everything. So the Hudson Valley Psychedelic Society, Decriminalize Nature, those are folks bring to the table, learn from them. That's the best way to go about things. If we can't rely on other people to learn from them, then we can't do our jobs effectively. You can't possibly know everything. I certainly don't know everything. I rely on experts. I rely on folks to come to me to tell me the facts so I can learn from them, so I'm not just off guessing things. I'm not relying on an internet search. I can actually have somebody I can rely on. When it comes to what I do now, when it comes to my past career, when it comes to things around harm reduction and trying to end the war on drugs, it was getting to know people. It was being able to rely on somebody I could make a phone call to and say, hey, I'm being told this. Hey, we've got this issue going on. Can you give me some advice? I got to talk to a community group. What do I tell my kids? How do I deal with this issue? And then recognizing that just because folks want to end the war on drugs, just because folks want to decriminalize or legalize drugs, doesn't mean that everybody just wants to have everyone out there having some kind of big party doing drugs. It's about how we have a safer community, it's about how we have a safer public, and it's about how we ultimately treat people like human beings and stop throwing people in cages. It's about how we actually build better relationships and about how we actually look at things through a public health response and not through a criminal legal response.